Let's listen to an expert doctor for hypertension in young population along with coronary artery disease and higher heart rate. Can be sure of happy heart? Today we have Dr. M. Jagadesh, MD General Medicine, DNB Cardiology, Lotus Hospital, Erode. Doctor, how do we define hypertension and when should we conclude that the person has hypertension?
Hypertension means high blood pressure. So when we record a blood pressure, we used to see two readings. One is systolic blood pressure and another is a diastolic blood pressure. So we call it and define it as hypertension when systolic blood pressure is more than or equal to 140 millimeter of mercury and diastolic blood pressure should be more than or equal to 90 millimeter of mercury. And when a patient is already on medications to control his blood pressure, he has already been labeled as a case of hypertension. So this is how we define hypertension in adult population who are more than 18 years old.
Doctor, can high blood pressure be completely cured?
That depends on the severity of hypertension when the patient is diagnosed at first. So suppose, as I told, when the patient is having just above 140/90, so we need to look at the reversible factors which can be cured in a patient. So in case of a overweight, sedentary lifestyle, lack of physical activity, poor sleep pattern, those kind of reversible factors, we can initially start with a minimal dose, and when those risk factors are being controlled, we can expect a little cure. In the sense, it can be controlled for the time being. So when the severity goes more than the grade 2 or grade 3, then the patient has to be on medications continuously so that his blood pressure will be under control. So cure depends on the severity of the hypertension and the presence of reversible risk factors.
Doctor, has there been a recent increase in the incidence of hypertension and heart attack among young patients? If yes, what could be the underlying cause?
In the trend of young people getting heart attacks suddenly. So we used to say this word suddenly doesn't apply all the time because many of the risk factors for heart attacks like high blood pressure, high sugars, high cholesterol will not be diagnosed unless the patient checks for it. So compared to the last 2 to 3 decades, nowadays the younger generation tends to develop these risk factors even 1 or 2 decades earlier in the age group. So there is no surprise that they will be getting heart attacks by around 35 to 40 years of age. And mainly the risk factors which are adding to our risk of younger generation is sedentary lifestyle, lack of any physical activity, poor dietary habits, intake of lot of junk foods and high salt contents, lack of adequate sleep, obesity, smoking, alcohol, and these are the many risk factors which are much prevalent in our younger generation. So that is the main reason.
Thank you, doctor, for your time.